Hello everyone, my name is Richard Mora. Today I will be delivering my demonstration speech. Unfortunately, I don't have an audience today, so let's just begin. Have you ever heard of rheumatoid arthritis, or RA for short? You may know some people who have it, but not know exactly what it is. You see, my mom has RA, and she's always told me how bad her hands hurt, her bones hurt. She's always in a lot of pain. So I figured it was just something that hurts the bones. It wasn't until I did my research and I came to find out that rheumatoid arthritis is a serious autoimmune inflammatory disease that targets the joints and the bodily organs within the human body. So, what is rheumatoid arthritis exactly? It is a complex disease due to its two-track systems, the autoimmune and the inflammatory. They work simultaneously, targeting the joints and the organs. According to the Gallic Encyclopedia of Genetic Disorders, rheumatoid arthritis belongs to a group of autoimmune disorders because in rheumatoid arthritis, your own body, your immune system attacks its own body by producing antibodies that attack the membrane that line the movable joints. So now that we have a brief understanding of what rheumatoid arthritis is, let me begin by explaining what rheumatoid arthritis does to the human body. So rheumatoid arthritis involves inflammation of the joints. The cause of this inflammation are white blood cells. Usually white blood cells attack foreign invaders such as bacteria, viruses, but in RA, they move into the bloodstream into a membrane that lines the body's movable joints. This membrane is called the synovium, and they are responsible for causing the inflammation in that area. This results in a condition that is called synovitis. The inflammation begins to release proteins that over months and years cause the synovium within the joint to thicken. These proteins begin to damage the ligaments, the joints, the tendons, all found within the movable joints, even the muscles. And so RA begins subtly. It starts in the fingers, and then it moves throughout the whole hand and then into the wrist. Same thing for the feet, starts in your toes, moves all throughout your feet, and then moves into your ankles. And you start feeling the inflammation. And when this inflammation occurs, it is very painful and it causes you to be very stiff, especially after waking up or when there's moments of prolonged inactivity. Wrist and knees are also known where areas of RA attacks. Wrist can swell up to the point where it can pinch a nerve and cause numbness and tingling. And when in your knees, they build up cysts, which are called rheumatoid nodules, and they swell up so bad that they can burst. And then when they burst, it causes even more swelling and even more pain in the knees. Something I never knew about rheumatoid arthritis, however, was the fact that in some extreme cases, it can spread to major organs such as the heart, the lung, and the eyes, causing severe complications and even vital results. The inflammatory process can sometimes involve other tissues and organs that go beyond the joints. So these are called the extra-articular manifestations. Patients who experience extra-articular manifestations are prone to serious heart conditions because of the thickening of the artery walls within the heart, causing heart attacks. The swelling in the lungs, which is called the pulmonary involvement, that are frequent or not clinically recognized. They captivate the lungs and cause it to tighten up, like almost if you had like acute bronchitis. But it's not bronchitis; it's actually arthritis that's causing the tightness in the lungs. And in your eyes, it can cause ocular infusions that prevent you from seeing because the cornea is beginning to melt. So now I have explained rheumatoid arthritis, what it is and what it does to the human body, what are the signs and symptoms, and how serious extra-articular manifestations are. Let me just cover it all up. Again, we can see that rheumatoid arthritis is a complex disease due to its compound systems, the autoimmune and the inflammatory, and how they work together to target the joints and organs. We identify the signs and symptoms that are mostly found in the hands and feet and are enlarged and deformed. Lastly, we cover the rare cases where extra-articular manifestations are associated with rheumatoid arthritis that affect the major organs like the heart, the lungs, and the eyes. Once again, rheumatoid arthritis is a serious inflammatory disease that at times can be overlooked and underrated because of the lack of information concerning it. However, it is something that can happen to all of us. Now that we are all more informed about what rheumatoid arthritis is, it should help us to be on the lookout for any of the signs and symptoms that we may be unaware of. So next time you hear or see about someone who has been diagnosed with RA, realize that their own body is destroying them from the inside out. Thank you very much.